Hey, hi Nilesh.
Hi sir, hi sir. How are
Hi
you?
Ashish. Hey, I'm doing good, man.
Hello, hi,
I
sir.
just managed to get hold of Dr. Ashlesh. He's my co-PG and friend from Nadiad.
Hey,
So
fantastic.
I had a lot of
Hello.
inquiries about Nadiad. So I thought I'll get hold of a person from there itself.
Absolutely, absolutely. Hey, it's a pleasure to have you, Ashish. Hey,
Thank
so
you.
I think we can start. We have around 50 people.
Yeah.
Uh, Time doesn't wait for people. So let's start. Hey, so it's a great pleasure to have with me Nilesh and Ashlesh. Nilesh is a very good friend of mine. So we have known each other much before this MCH thing. I knew him before I started Search Test, to be honest. Um,
Right.
we shared a common mentor. And so
Yeah.
it was a great pleasure to talk to Nilesh quite often, in fact. So, yeah, great to have you. So, Nilesh and Ashlesh, both brilliant urologists and who have just passed out. So, I think they will be able to give you a very good perspective of what to look for in an institute. What are the key parameters you should be looking at? Is it academics? Is it the hands-on experience? Is it the mentorship? I think everything matters, and but Nilesh and Ashlesh should be able to shine some light on that.
Sure.
And uh, one thing is that when you want some very detailed reviews, now that might be very difficult for us to give detailed reviews about every single institute over here. So what I think you can use a group, and also you can personally DM Nilesh and Ashlesh as well when if you have any doubts as well regarding specific institutes. But I think they'll give you an overall idea. You'll also be able to talk about a few institutes as much as they know as well. So yes, Nilesh and Ashlesh, thank you so much. You guys have a great time. Thank you.
Thank you, Vinayak.
Thank
So,
you.
I'll just start with a little brief introduction of about myself. I am Dr. Nilesh Taneja. I've completed my MBBS and MS from Safdarjung Hospital, Delhi, and then I've moved on to complete my DNB Urology this year from Apollo Hospital, New Delhi. Ashlesh, if you could also just start off with.
Yeah, so I'm Dr. Ashlesh Bhausar from Gujarat, and I did my MBBS and MS from Surat, and my DNB urology is from Nadiad. So, yes, we can go
Yeah.
ahead. We both did from
So,
very good
yeah. So,
institutes.
right. So, I'll just give a brief overview to all the urology aspirants, and I consider all 50 of them or 100 of them, whoever has joined, to be urologists already, because this is the most important exam that they have already cleared. They have secured a rank in NEET SS, and then they are looking to join something. So, welcome to all budding urologists. And just want to give you a brief overview about what urology is. Urology is, very different from general surgery, in the sense that these days in our surgical training during MS, the urology exposure is very negligible. So we don't really know what all encompasses urology. Urology is a branch on its own. For example, say in the US, urology is not a specialty that a person does after general surgery. You directly match into a urology program or you match into a general surgery program. So urology on its own is a huge umbrella branch that has multiple subspecialties, and so no matter where you do your 3 years of training from, you will not end up becoming a full-fledged urologist. You will be able to practice on your own, but it requires a few more years of training after getting your degree, because there is just so much to learn and that is not possible in 3 years. So no matter you do it from the most premier institutes or the institutes that go far behind in the merit list, it doesn't matter. As far as the 3 years are concerned, your job is to go through the training, the rigorous training, with as much sincerity and diligence as possible, so that you end up learning the most that is available in your hospital. So, briefly, urology has endourology, it has transplant, it has oncology, it has pediatric urology, minimal access, lab and robotics, and then there is reconstructive urology. So, not every institute will have all of these branches, subspecialties in that institute. So, you will not be trained in everything, but your institute will have something which is specific to that institute. So, for example, in my institute, the endourology training is exceptional. So, similarly, other institutes, some place may have a very high number for transplant. Some place may have a very high oncology or robotics. So some place would have a very high number of pediatric urology or reconstructive part of urology. So you will be trained in something during your 3 years, and you will have to cover up of the for the remaining part after you get your degree. So I mean, I'm just giving this overview so that we manage our expectation. Ashlesh, you will not believe, I have got a few phone calls where people have asked me how much console time on a robot they'll get during their 3 years. So
Right.
थोड़ा सा मतलब, I think we need to manage the expectations that what all is there. At this point, when you enter into a urology program right after your MS, so you will not be in a position to plan treatment for the patients that you see. The treatment planning is the most complex part. Surgical technique is actually easy because endourology is actually easy, fairly straightforward, fairly easy, shorter learning curve. You will not have a problem with that. But the planning part is the most challenging part, and that is something that we struggle with all 3 years. So, like with that overview, I will just start. And Ashlesh, we both are
Yeah.
DNBs. We are not
Right.
MCH. So, like,
Right.
just can you give me something, some insight into why you chose DNB over a MCH program? Because I'm sure you've got
Correct.
Nadiad, so you've got a better
Yeah.
rank than me in NEET SS. And even I had MCH options, but I did not choose it. So,
Correct.
what was your thought process behind it? And then I'll share mine
Correct.
also.
इसमें ये रहता है कि सबसे पहली इंपॉर्टेंट चीज है मतलब एवरीबॉडी इज रनिंग आफ्टर गेटिंग एन एमसीएच रादर देन गेटिंग अ डीएनबी सो
Yeah,
लाइक एमसीएच इज मोर प्रेफरेबल देन डीएनबी फॉर एवरीबॉडी बिकॉज ऑफ इट्स नेम
yeah,
पर इसमें क्या होता है कि सुपर स्पेशलिटी इज वेरी डिफरेंट फ्रॉम जॉइनिंग एमएस लाइक अ ब्रॉड स्पेशलिटी कोर्स
yeah,
बिकॉज by this time you are married and you want to live in a city which is where you belong to or where your wife is, so things like this where there's a good stipend, where there's a good where there is no bond or less bond, so these are the factors you need to consider, just apart from the name of the institute. So
hmm,
name of the institute as well as the hands-on and the quality of work is just one small part, and these other factors which affect, which is a very big part of your personal life, should be considered while making such decisions. Uh,
that,
yeah,
yeah,
and about MCH and DNB is that, see, I had got a rank of 120th in the urology.
yeah,
So, yeah, I was getting SMS Jaipur, this PGI, and then all the medical colleges in South India. But
yeah,
then Nadiad was, I was getting a full thing that Nadiad has a very good name.
yeah,
And it was just 80 kilometers, 50 kilometers from my hometown. So these were the factors for which I chose. And most of the experienced urologists I spoke to, at least in Gujarat, they said that Nadiad is the Mecca. आंख बंद करके उठा लो, आंख बंद करके उठा लो. And urology में क्या है कि, yeah, as Dr. Nilesh had said that decision making is the key. मतलब वो ऐसा नहीं है कि तुम डिसीजन मेकिंग, तुम अपने मेंटर से क्या सीख रहे हो उससे पता चलेगा, क्योंकि एंडो यूरोलॉजी भी एक सिर्फ एक छोटा सा पार्ट है यूरोलॉजी का. उसके अलावा बहुत सारी चीजें हैं यूरोलॉजी में. लेकिन हम जब सोचते हैं कि यूरोलॉजी करना है तब हैंड्स ऑन चाहिए, ये चाहिए, वो चाहिए, तो वो सिर्फ पार्ट किस में होता है? जो लोग बोलते हैं कि हैंड्स ऑन ज्यादा मिल रहा है, वो सिर्फ किस में होता है? सिर्फ स्टोन केस में. तो यूरोलॉजी में सिर्फ स्टोन तो बहुत छोटी चीज है, उसके अलावा
yes,
काफी चीज है. So
बिल्कुल.
you need to get all these things in consideration.
Hmm.
And yes, first आपकी choice dependent होनी चाहिए. अगर आपका कोई dream institute है तो well and good, go for it. अगर आपका कोई ऐसा नहीं है तो you should think about the other parameters which I just said.
Hmm. Ashlesh, do you have any idea about the MCH colleges in Gujarat?
Yeah, so MCH in Gujarat is there's a program in BJ Medical College and then
Right,
there's IKD. So
right.
IKD में क्या होता है कि वो top, वहाँ पे
That
3
is the
seats
first
है.
ranker.
Yeah.
See, first
So
ranker, we can forget about him. वो
correct.
बंदा नहीं है सर्च टेस्ट में हमारी काउंसलिंग.
Correct.
फर्स्ट रैंकर
Correct.
नोज उसको क्या करना है. वो सोच रहा है अभी कि उसको जीआई करना है कि उसको यूरो करना है. तो उसको वी
Correct.
आवर डिस्कशन इज बेस्ड ऑन फोकस्ड ऑन द पीपल हु आर इन द मिड रैंकर्स,
Right.
जो
Right. Right.
एनीवेयर बिटवीन
Yes.
50 टू 1500,
Yeah.
2000,
Yeah.
ये तब तक के
S-
रैंक पे हम फोकस कर रहे हैं अभी.
तो
तो
आपको अगर, या
हाँ, तो बीजे
Tra-
का जैसे फॉर एग्जांपल या
hmm,
आउटसाइड गुजरात बाकी जगहों पर जैसे
हाँ,
एसएमएस जयपुर, यू डिड नॉट चूज
correct,
एसएमएस जयपुर, वाज
correct,
इट
correct.
जस्ट फॉर द डिस्टेंस फॉर यू और वाज इट आल्सो
No,
द ट्रेन?
yes, वहाँ पे ट्रेनिंग में क्या है, सी एसएमएस जयपुर हैज अ वेरी गुड ट्रांसप्लांट सेटिंग एंड ऑल दैट आई हैव हर्ड, बट देन द नंबर ऑफ रेसिडेंट्स देयर आर 10. सो व्हाट
या
हैपेंस इज इतने सारे लोगों में तुम्हारा काम अल्टीमेटली डिवाइड ही हो जाता है यूनिट सिस्टम
एब्सोल्युटली,
में वगैरह. एंड
एब्सोल्युटली।
देन इंस्टीट्यूट्स में, ये सब इंस्टीट्यूट्स में क्या होता है जो सिर्फ यूरोलॉजी पे फोकस नहीं करते, कि इतना एडवांस वर्क नहीं हो पाता है.
हम्म।
The मतलब you cannot just focus on endourology or just transplant. There is oncology. तो ये सब departments miss होते हैं कोई कोई जगह पे. So these are the reason. Another thing is bond if it is strictly
Bond
followed.
is huge. So, like to sum up between DNB and MCH, see, first of all, it's a personal decision. Secondly, urology is one such branch. जिसमें I would say that DNB is actually takes a step over MCH, especially for tier two, tier three cities. MCH with in state colleges जिनके पास funds नहीं है. They are lack of funds, lack of equipment. OT availability is not there, anesthesia backup is not there, ICU backup is not there. So their training is limited by these factors, and especially for these places, DNB in a metro city or DNB in premier institutes like Nadiad, these are the hospitals that actually provide you with better training. So between DNB and MCH for urology per se, I would say that DNB actually, you know, just nudges over MCH. So that is one. Second, what everybody should think at this age, when you see, when I joined, I was an unmarried person. I got married during my DNB program. Most of us are having a family, and you need some sort of support from that family, and you need to give time to that family. Most of you would be having, a lot of you people would also be having children. So you need to give support to them also. So it is a good idea to be near your home. Ankur, can you please mute them, please? Yeah. So I'm just saying that it's a good idea to be in your home state compared to moving to another state, to really look at what you're going to gain. Not that people don't travel. People travel, it's about 3 years, and training obviously takes precedence over other things. But this is also one thing that you must consider. Along with the things, there's a bond ki baat, you have to carefully see the bond. Bond, take as a blanket statement, take it ki bond is strict everywhere. Because even in states which were not having a strict bond previously are now becoming very strict with their bond. For example, in Rajasthan, earlier they were not care about the bond, but now they have, this year onwards, they've become very strict with the bond. So with change of government and change of policies, these things are always in flux. And as a blanket statement, assume that bond will be strict. So, I mean, after having navigated this DNB and MCH situation, um, for example, I mean, I would give you an example of Delhi. Delhi MCH goes high up. If you have the rank for it, you can opt for it. The training is similar to DNB in private in premium institutes. Um, what else? So we have a few questions, Ashlesh.
Yeah.
They're asking,
Yeah. So in
about
general, I
SGPGI.
would
See,
like to.
SGPGI, I will just take this question. SGPGI Lucknow is a premier institute. So that their training and their their department is very well developed. They have a very good transplant, endo euro everywhere is there. They have a very good pediatric department also, as far as I've heard. So their I mean, don't compare SGPGI to another place, any other place. The only thing that you have to see at that rank is whether you are okay with the bond, because UP bond is strict. Then Gangaram versus Nadiad, I would say Nadiad. I mean, Ashlesh will be a better person to tell about Nadiad, but
Yeah.
both are premier institutes. You have to decide based on your location. I mean,
Yes, exactly.
yeah,
The
Ashlesh.
location is the most important thing here. See, both the places, Gangaram as well as Nadiad, have almost similar stuff. The consultants there and the mentors there are really awesome. And like these places don't just train you just out of the residency, but then they take you quite ahead. Like um, they take you to big conferences. You get involved with a lot of big people, which opens up doors of opportunities for you. Like for surviving in Delhi or other big cities, you need to do something beyond just urology. After that, you need to do something like uro-oncology or specifically in transplant. So these places give you better opportunity to uh, get interested into such things. So
Yeah.
yeah, between Gangaram and Nadiad, if you are from north, then definitely go for Gangaram. And if you are from Mumbai or in South India, then yes, Nadiad is a better option.
Yeah, absolutely. Similarly, as far as with Nadiad and I think BT Savani Rajkot also has a good enough hands-on, not so good academic background compared to Nadiad. Nothing is good in academics. So, but as a thumb rule, you can safely say this is for the mid rankers that a metro city DNB is better than a tier 2, tier 3 city MCH program. In DNB program, you have, for example, in my hospital, and that's true for all Delhi hospitals, you have OT on every day. So you have that exposure every day. And your stay day typically starts around 8:30 a.m. and it ends by 6, 7 p.m. So you end up being spending almost all your time in the theaters, learning from in a very close contact with the consultants, and learning the practical things, the whatever the take home message for every surgery, nuances of urology and all of that, compared to MCH from say a tier 2 tier 3 cities. See, they have limited resources, limited OT. For example, I did my MS from Safdarjung, Delhi. There, the anesthesia limitation was such that we would not have general anesthesia cases posted after 3 p.m. Forget general anesthesia, after 3:30 they won't even post spinal anesthesia cases. So that is how, and you have 2 or 3 days of OT in a week. In corporate hospitals or in DNB trust hospitals, you have a mix of things every day. You have activity going on every day. So you have general anesthesia cases going on till 8 p.m. You have robotics, you have laser, you have all sorts of high-end technology available and
Correct.
instrumentation
Correct.
available to you. So in that sense, your exposure during the 3 years becomes manifold. So what you will learn in a metro city DNB or a premier institute DNB in say 3 months time, you will take the same learning in tier 2 3 MCH place in 6 months 1 year time. So your learning will remarkably increase. I can see a question from Dr. Anirudh regarding Apollo Chennai and Madras Medical College. So Madras Medical College is the best college in Chennai for MCH, but I feel the hands-on and the training in Apollo Chennai is better than MMC. I mean, that's my personal opinion. I would advise you to talk to the people. I know a person, my senior, Dr. Dirush from Apollo Chennai. He's 1 year senior to us, Ashlesh. And during his 3 years of DNB, he's had a significant console time on the robot. So
Right.
this
Right.
is just unheard of in a government hospital. So, I mean, if you have a good rapport with the consultant going on in a corporate hospital or a DNB institute, you can go over and beyond the uh, typical training that a urology resident undergoes. So that is how it is. Similarly, SGPGI versus RML Delhi. Again, Dr. Praveen Gehlot has asked this question. I would emphasize on the fact that choose your city, choose the bond first. Delhi MCH did not have a bond earlier. I was hearing that it is starting this year. Bond is starting in Delhi this year. So just confirm that whether Delhi has a bond or not, and then choose between Delhi, Lucknow. If you are from Delhi, you. If you are from Delhi, you can still go and choose SGPJ Lucknow because of brilliant academic environment over there and the overall exposure that you get. But if you are from Lucknow, you're getting both the institutes, there's no point coming to RML Delhi. Then Medanta versus Gangaram, as Medanta also has new consultants. Dr. Naveen is asking, see, for Delhi as a thumb rule, Gangaram over everything else. Gangaram is your first choice. So Gangaram becomes the first choice. After that, Medanta, Apollo, and Max Saket. These are three institutes which have equivalent amount of training. There is minor differences. One thing is better in one hospital, the other thing is better in the other hospital. So you can just get in touch with the people who are there. I, for example, I'm in Apollo. So I can tell you more about what are the things good in Apollo, what are the things not so good in Apollo. Apollo, the transplant department is a separate department. So we don't have enough exposure in renal transplant. Because of that, our lap donor nephrectomy skills are not almost non-existing. But what we do, compensate for that is we spend all our time in endourology as a result. And by the end of 3 years, we have a very high number of independent PCNLs. So there are minor variation. That the same is not true for Medanta or Max Saket. There, the number of lap nephrectomy assisting and performing independently becomes a little higher, and PCNL comes way below. So that is something that you have to like just tinker your choices a little bit and talk to specific hospital PGs so that you understand what exposure is there and what is most appropriate for you. So that Abid, I've told you the sequencing of Delhi. So Gangaram, then Max, Medanta, Apollo. You can choose in between them in any order. I've told you there's some advantages of one hospital over the other. Then you have BL Kapoor and Venkatesh, Batra. These hospitals again. See, if you get DNB anywhere in the country, you take it because overall I'm saying you will be left with something or the other in your training that you will have to cover up after your 3 years of degree. Once you get your degree, then you cover up in whatever is left. So if you get a DNB program in urology anywhere in the country, you take it. There is no point in giving the exam again. I cleared my NEET SS in the first attempt and I was getting DNB in Delhi. So I talked to my seniors in Safdarjung who was doing MCH in Safdarjung, and they told me the same thing that they are if not as good, they're equivalent. So that it does not justify you to take a drop year and prepare again for the exam. You would do much better than by just joining the place. Take the best out of your institute. See, it's more than about the institute, it is about you, the candidate, the student, the resident. It is about you, what you take out of the institute in your program. So it depends on you. No two people in the same institute will have the same training. It will, I mean, you will have to be a little proactive during your training period and try to learn as much as possible in whatever time and whatever limitations that you have. Then Balaji Action Institute is this time it's a new institute. First time the DNBs are going to be there. I know the senior consultant who is there in Balaji Action, and he's a phenomenal consultant. He does all sorts of urological surgery, so training will be good. But as it is a first time, we have really no details. So you can put it under your preferential order. If you get it, you take it. Similarly, RML Lucknow versus Max Saket, Dr. Ankush, see, this is again that discussion which includes your MCH versus DNB that we've discussed, the bond situation where you are staying and all of that. RML Lucknow, training wise, I'm not too sure. You have to also consider the department toxicity. I had a junior who must be here in this meeting probably. She had joined RML Lucknow and didn't work out too well for them. So, I mean, just talk to the person before your before choice filling. So, at whatever rank that you have, you know based on the previous counseling what realistic options you have. So, make a list of those 5, 10 colleges because choice filling will be very crucial for those 10 colleges that you are likely to get, and try to get in touch with the PGs who are working there, get to know about hands-on, get to know about academic environment, get to know about the department toxicity. And these things I feel are the most important. In a toxic environment, no matter how willing you are, you will not be able to learn so much because you will not be stable mentally. So you really need to be in that zone where things also, your environment is also conducive for you to learn. How is Grant Medical College Mumbai? Mumbai MCH all are very good. Just again about the department toxicity is different for every hospital. So just have a look on that. Mumbai DNBs are also equally good. So you can, if you are from Maharashtra and you are getting Mumbai MCH versus DNB, I mean, I am inclined towards believing that the training and hands-on will be slightly better in the MCH program in Mumbai, in Grant and KEM especially. But it's not like the Mumbai DNBs, the training suffers because of that. So if you're getting DNB, you take it. The academic environment in Mumbai is way better than the academic environment in Delhi. Opportunities for DNB versus MCH in tier 1 are actually slightly better for the DNB because you tend to get absorbed in your parent institute. Like, I think Ashlesh has got disconnected for some reason. He was traveling. So, he's before, when he was giving his theory exams for DNB, he had a stable, he already got an offer, and he was just asked to join after he passes his exam. Similarly, I in my hospital, I have continued in the same hospital as an attending consultant. So the corporate hospitals actually prefer DRNB urology graduate over MCH from another state because they know they have a certain expectation about your training as a DNB student during the 3 years, the kind of cases that you would have seen and how you would be able to manage those cases. They have I mean, that's been my experience. They have a more reliability on the DNB part, especially in tier 1 cities. Um, how is Institute Nephrology in Bangalore versus KIMS Hubli? Again, Dr. Vignesh, I mean, I would like go in favor of what has been picked up in the previous counseling results. So I believe Institute Nephrology Bangalore is better than KIMS in that sense. But details, I'm not too sure. You need to get in touch with the PGs who are working there. Um, PGI Rohtak, Dr. Rishabh had a house PGI Rohtak. So people prefer PGI Rohtak because it used to have a lesser bond, I guess, or maybe no bond in Haryana. But the department is not very well known in PGI Rohtak. So that is, I mean, this is information based on 2 years back. So what is the current situation? Just find it out. Um, Yeah, Ashlesh says that you should visit the place you want to fill as the top choice before you actually, before the counseling situation ends. Because I think this comes from a lot of personal experience and back home at Nadiad, not a lot of people get adjusted to the city. So I think there's a tongue-in-cheek comment from him. Um, RML Delhi versus SGPGI Lucknow, which should I prefer if I am from Mumbai? So if you are from Mumbai, then both are away from home. I would suggest you go for a more academic institute where you learn the treatment planning. If bond is similar or not an issue for you, then I would suggest you to take SGPGI Lucknow over RML Delhi. The disadvantage that I would say about SGPGI Lucknow is the department toxicity. As far as I think there were a few reports coming in from last year and or the year before that the students who had joined there as a first year, they were not too happy. So again, as a thumb rule, I mean, I would say manage your expectations during the first few months of your first year. See, your exam, this batch is a little delayed. So your immediate senior who has had a 15-month, 16-month period of first year. So that person is your immediate senior would be a little bit, frustrated with their department because first year, no matter which branch, which hospital, which state, doesn't matter how friendly that place may be, first year can get to you after a point. So in the first few months, you will be just managing the workload of what a first year PG is. They'll completely, dump all the work on you, and that's okay. So you expect that, and then you go to a place because that will help you with not getting frustrated so easily. Uh, So for Delhiite, Max Saket or Nadiad, see, Dr. Ayush, I am also a Delhiite. I chose a Delhi DNB over outside Delhi DNB. That's another thing, that at my rank I was not getting Nadiad. So that's a separate issue. But even then, see, it depends on your personal situation. Urology anywhere in the country is not chill as far as the work life balance is concerned. During residency, it is not chill. You will be spending around 12 hours, 10 to 12 hours on an average daily in the hospital. Urology is much more busy than general surgery program. General surgery PG is busy because of other reasons in a government institute, but urology, you are doing hardcore clinician and surgeons work, so you will not be free. So no matter whether you do it from Max Saket or Nadiad, you will not don't look for a work life balance, especially in your early days of residency. You will not get it. So if you are a Delhiite and personal life and family, you want to stay near family, I would say you choose a place that is in your home state. So you choose Delhi in that sense. But if you can tell yourself that you can go through a period of 3 years, which are rigorous training, then you will reap the benefit of being in Nadiad. Again, the benefit, you have to like make that calculation for yourself, how significant that difference is. So, for example, I was getting Apollo Chennai, Apollo Delhi. The hands-on training numbers for Apollo Chennai are better than Apollo Delhi. But for me, it would not have made sense for me to go to Apollo Chennai, try to learn a new language, understand a new culture, and feel like an outsider for the first few months, and then come back to Delhi. It was not making sense for me, whatever the significant difference in hands-on numbers were there. So that is something that you need to, answer for yourself. SMS Jaipur versus GMC Kota. I think SMS Jaipur takes precedence because they have a bigger department, so they will have much more wider variety of work that is happening. So that is how I feel. Again, ask the PGs there, but to answer Dr. Deepak's question, I would have chosen SMS Jaipur over GMC Kota. Uh,
जीएमसी कोटा के बारे में अच्छे ही रिव्यूज है like the hands-on and urethroplasties and everything is very good over there.
okay, 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 okay. Ashlesh, any idea about Assam, West Bengal, Patna, these places?
So I have a senior in my hometown who is
Hmm.
practicing as a consultant over there, and he's doing extremely well after just 3 years of residency at GMC Guwahati. And what is the other place?
West Bengal, Patna.
About Indira Gandhi in Patna, I've heard it is very good. Again, these all places come when you belong to uh, that place.
Right.
Else, you should always choose a place which is in because that will open up a lot of opportunities after your urology. For
Exactly.
example,
Hmm.
if you are from Delhi and you are doing a DMB from somewhere in Delhi, what you are going to do after your DNB will be decided during your residency. For example, Dr. Nilesh has joined his hospital as a fellow consultant at his place. So that opportunity he could get only because he studied there.
Absolutely, absolutely. I mean, uh, I know for a fact that the administration has taken me preferentially because I was from there, because they feel that I will be more suitable for that position. And similarly, like 3 years of training anywhere, the networking is also important. So those things
Correct.
do make a difference. And not everyone would, go in for a fellowship program after completing MCH or DNB. So you would be looking for job prospects after that. So it is a good idea to do your residency from an area which is close to the place that you ultimately intend to set up in. Then one person is asking, how is RR Delhi if bond is not an issue? I would say the RR is a very good institute, and if bond is not an issue or you are a person from the army, then just close your eyes and take opt RR. That's not a problem. I mean, RR is the premier institute in the army thing. So you can consider RR to be the aims of army hospitals all across the country. They have the best of resources, the best of facilities. They have a very good academic and training program. The only issue was the medical fitness and the bond. So if you are, this is actually very important. If you get RR in your round one and you are found to be medically unfit, then you are not eligible for round one again just because you're medically unfit. You will not get the second, the option you filled after RR. You will directly go into round two. So round two, whatever options, then where we will be left. So there will be very limited seats in round two because most of the people will get something in round one. So that is something that you need to be really sure of about your medical fitness. There are criterias about the medical fitness in army. If you can just get a mock fitness done before the counseling and just find out if you come under the medically fit category, then I think RR is a very good option and you should take RR. um, Kerala DNB, Ashlesh, do you have any idea?
Kerala DNB, I was at this KTCon, that is a kidney transplant conference, just a day back,
Right, right.
and they have very good transplant volumes. All the this Aster Medicity and then Medical Trust Hospital, they are all very good for transplant. One thing I've heard about South India is that the PCNL training specifically only for PCNL is not as like the hands-on is a little less in
Yeah.
those institutes, but that also depends on which place you are exactly.
So Dr. Advait asked this question, how much does transplant exposure matter? Do you have to do transplant fellowship even if you have a good exposure during your residency? And do you have to consider if transplant is less? So I'll just briefly answer this question and I'll push it to Ashlesh. So in my hospital, for example, we don't have transplant. But so that there is a clear disadvantage if you don't have transplant because you're not exposed to managing an entire subspecialty within urology. But what happens as a result is you have the same 12 hours in the hospital. So you end up doing whatever other things are there. So we have a huge exposure and caseload in robotic and oncology part and endourology. So we end up spending a lot more time in endourology in that sense. But I mean, it still does matter. But if you don't get an institute that has transplant, not every institute will have transplant. So it doesn't mean that you will not take it. You will still take it, take the best out of that institute, and move on in life. Ashlesh, what do you think about?
Yes.
Do you think you need a transplant fellowship after Nadiad?
नहीं, सी
That
जिस
time.
जगह पे ट्रांसप्लांट होता है तो उसके बाद ट्रांसप्लांट फेलोशिप का आई डोंट थिंक सो देयर इज एनी
No
नीड,
role, no role.
क्योंकि फेलोशिप्स में यू आर जस्ट गेटिंग वन सिंगल पार्ट विच यू हैव ऑलरेडी डन इन योर ट्रेनिंग, सो दैट डजंट ऐड एनी एडिशनल एडवांटेज. तो अगर तुम्हें ऐसा मिलता है सेंटर जहाँ पे सब कुछ होता है इंक्लूडिंग ट्रांसप्लांट एंड ऑन्कोलॉजी, देन यू शुड गो फॉर सच अ सेंटर.
I agree. And also, what transplant adds to your skill is you end up doing a lot of lab donor nephrectomies. So your lab skills improve remarkably. Maybe in your hospital, in whatever hospital, you will almost never get the hilar part. But just dropping the colon, there is a very fine line between the mesocolon and the retroperitoneal fat. And first 10 cases, you will always mess up that line. You will not be able to do the initial steps. So that exposure, I feel, with as far as the lap nephrectomy part is concerned, donor nephrectomy, that exposure increases a lot if you have a transplant program in your institute.
इन मतलब अभी के जो सेटअप में मिनिमम नेसेसिटी है लैब, रोबोट अगर नहीं मिला तो ठीक है, लेकिन लैब तो होना ही है. तो
बिल्कुल।
लैब उसी इंस्टीट्यूट में होगा जहाँ पे ट्रांसप्लांट के लिए वो लोग लैब डोनर करते हैं, तो उसके साथ दे विल बी डूइंग पाइलोप्लास्टीज, they will be doing a lot of radical prostatectomies laparoscopically. Yes, so lab is a very important part, and that will add to a lot of your training.
Acha, Ashlesh, one like fundamental question. Do you think it is worth it to do an MCH program from a private hospital? Somebody say if you're getting DNB, there's no question about it, you take DNB. But
Correct.
there are few people who will also, miss out with the good DNB, and in their state they will be getting good MCH, in a private hospital. But they have a
Correct.
good high enough fee around 10, 15 lakh, 20 lakh a year. So you end up spending, 50, 60 lakhs in 3 years' time. So
Correct.
what's your opinion on that, yeah?
See, if you are not getting anything, like अगर फ्री में जो मिल रहा है वो ही लेना, ये इस पे सही रहेगा। और डीएनबी एकदम एकदम एवरेज इंस्टीट्यूट में डीएनबी मिल रहा है वर्सेस तुम्हें मणिपाल जैसे इंस्टीट्यूट में अगर तुम्हें एमसीएच यूरोलॉजी मिल रहा है, तो क्योंकि मणिपाल में भी काफी सीट्स है और वहाँ पे मिल जाता है, तो
Hmm.
आई थिंक दैट एमसीएच इज बेटर देन द डीएनबीज।
Hmm. Hmm. Okay,
So
great.
yes, if you are not getting, and if you are ready and if you can pay, definitely go for it, because yeah, it is very getting a urology over general surgery and not waiting for 1 year is one more advantage.
Yeah, I mean, my take would be, if you can give the exam one more time, if you can do that, uh, you can do that, because you will be there are few places MCH urology in private that are very good, that we know only after we come to know only after entering into urology department, into the urology scenario. But as a rule, I'm not sure. If you can give the exam again, I think that will be worthwhile. Mumbai DNBs are all good. There is I think PD Hinduja goes at the top. उसके बाद बाकी आते हैं. Just take the VIP hospitals, put the VIP hospitals a little lower on your list, because उसमें थोड़ा hands on आपको और कम मिलेगा. But more or less it will be the same. Uh, Ashlesh, I think the questions will be never ending. One final parting thought that I would like you to answer, because I have got this question. Not I've not got this question here, but on my calls I've got this question कि नाडियाड को चूज करना है कि नहीं. वहाँ पे हैंड्स ऑन बोलते हैं, लेस है, ये वो कम है. तो जस्ट क्लियर द एयर अराउंड नाडियाड,
Yes,
बिकॉज
yes,
I mean,
sure.
I feel it's not enough from me coming कि नाडियाड ले लो boss. Nadiad is very good.
Correct, correct,
If
correct.
if your other things are sorted, take Nadiad. Nadiad is very good. So just from your experience of 3 years
Yeah.
in Nadiad, how
So
has, I mean, your 3 years been? How is the academic environment? I mean, the department toxicity तो है नहीं. How the relationship dynamics in Nadiad and all of that?
correct.
उसके बारे में बताओ भाई.
Nadiad, I felt that is the most welcoming place. Like they make you feel like you are the part of their family, and you
Hmm.
are close to the real stalwarts in the field of urology, like Dr. Mahit Desai, Dr. Sabnis, and even the young consultants. And they make your entry easy into the USI politics and everything. You are
Hmm.
not going to get that benefit anywhere else. So that is one benefit. See, in 24, I had got this USI traveling international fellowship. I got it because I had an US visa, just because Dr. Sabnis sir asked me to get an US visa. He promotes that कि सबको conference में जाना है, सबको सबके पास ये होना चाहिए, visa होना चाहिए. So he'll make all the necessary things that you can get a visa. So things opportunities like that you are not going to get anywhere else. एंड अबाउट दी हैंड्स ऑन एक्सपीरियंस, फर्स्ट ईयर तो कहीं पे भी कोई भी इंस्टीट्यूट में आपको ऐसा ही लगना है कि कमी मिलेगा, क्योंकि फर्स्ट ईयर की बेसिक प्रोसीजर, जैसे हमें एमएस में अपेंडिक्स मिलता था या फिर डेब्राइडमेंट वगैरह मिलता था, सेकंड ईयर में अपेंडिक्स मिलता था, तो फर्स्ट ईयर में क्या होता है, डीजे स्टेंट डालना होता है या फिर डीजे स्टेंट निकालना होता है, सिस्टोस्कोपी करना होता है, या फिर यू हैव टू असिस्ट इन योर रोबोट और बी अ कैमरा ड्राइवर इन द लैब केसेस, या फिर
Maybe
ट्रांसप्लांट में।
URS by the end,
करेक्ट,
we would get URS, RIRS. So what you
करेक्ट,
said,
करेक्ट,
stone cases you will get.
करेक्ट। सो अभी तुम अगर फर्स्ट ईयर में एक्सपेक्ट करोगे कि पीसीएनएल करना है,
तो फिर
हाँ
वो तुम्हें नहीं मिलेगा। अभी कोई
नहीं मिले
गवर्नमेंट
क्या,
मेडिकल।
basically you will not understand in first year.
करेक्ट,
That is the reality of it.
करेक्ट, करेक्ट, करेक्ट। सो यस, हैंड्स ऑन मुझे फर्स्ट ईयर में पर्सनली ऐसा लगा कि नहीं मिल रहा, नहीं मिल रहा। पहले 3-4 महीने ऐसे निकले, एंड देन सडनली द बूस्ट हैपेंस आफ्टर पीपल start noticing you. And what Dr. Nilesh had said, that all depends on you and how you are working, how your work ethics are. So everything depends on that. अगर अच्छा तुम काम करो तो तुमको फर्स्ट ईयर से ही अच्छी चीजें मिलना शुरू हो जाएंगी। एंड
बिल्कुल।
नडिया, अभी क्या है कि जैसे RIRS, अभी PCNL तुम कहीं पे भी देखोगे तो सिर्फ एक सर्जरी के बेसिस पे तुम्हारा रेसिडेंसी चूज मत करो, क्योंकि PCNL नंबर्स अभी कम हो रहे हैं। द साइज ऑफ द स्टोन इटसेल्फ इज डिक्रीजिंग। अभी 1-2 सेंटीमीटर के ही और अर्बन एरियाज में तो इतने ही साइज के स्टोन होंगे। तो RIRS मैंने 50 करके निकला हूँ, मतलब 50-60, और वहां पे 6 रेसिडेंट्स। तो सोच लो कि दूसरे लोगों ने तो किए, साथ साथ में 300 RIRS हैज बीन डन बाय रेसिडेंट्स ओनली
या
ओवर 3 इयर्स। बाद में तुम फिस्टुला करोगे, फिस्टुला में भी मैंने 40-50 फिस्टुला किए हैं। ट्रांसप्लांट में मैंने खुद एनास्टोमोसिस कंप्लीट पूरा ट्रांसप्लांट दो किया है। डोनर नेफ्रेक्टोमी 10-12 की हुई है। एंड PCNL भी 10-12 हो जाते हैं। सो अबाउट 5 केसेस एवरीथिंग इज फाइन, और यू हैव सीन सो मच, एंड द लेवल ऑफ द केसेस यू सी देयर आर वेरी वेरी, मतलब रेफर्ड केसेस भी होते हैं। अभी सबने सर के पास जो केसेस आते हैं वो किसी 5 यूरोलॉजिस्ट से नहीं हो पाए होंगे, वो उनके पास आएंगे।
बिल्कुल
तो
बिल्कुल।
इमेजिन दैट such cases. So it's all very good, and hands-on is not at all an issue. And apart from that, the opportunities, you get to go to the conferences. There are onco board meetings. There is onco pathology meetings. Everything. So तुम्हारा जो डायमेंशन है वो बहुत बढ़ जाएगा। फॉर एग्जाम्पल आगे तुम्हें जाके यूरो ऑन्कोलॉजी करना है तो तुम्हें पता ही है कि ये होता है। ऐसा नहीं है कि तुम्हें कहीं ऑब्जर्वरशिप जाके करनी पड़ेगी या फिर देखना पड़ेगा कि क्या होता है ऑन्कोलॉजी में। इट्स ऑल एवरीडे स्टफ। एवरी ट्यूसडे देयर इज अ यूरोपैथोलॉजी मीटिंग वेयर यू विल बी, द पैथोलॉजिस्ट एंड द यूरोलॉजिस्ट विल मीट एंड डिसाइड अबाउट द हिस्टोपैथोलॉजी, एंड द डिसीजंस विल बी मेड मेटास्टेसिस केसेस के लिए।
या
या
No, great. I mean, this has been great, Ashlesh. Thank you so much, yaar, for giving insight and joining, है ना? Because
या
I've got a lot of inquiries about Nadiad, and I felt that, I could not come. I mean, I've been to Nadiad twice, so I have a very outside overview about how Nadiad would be. And वो जो भी मुझे दिखता है, I love that place. So I mean, I thought I'll get a person from Nadia to give you the real true inside stories ki what it is about. And if you get it, I mean, there's no other place. Like he said, urology, Nadia is urology's mecca main. You learn so much from every visit to Nadia. So if you are getting that in at your rank, and you are okay going to, I mean, on your home state or nearby states, and you're okay going there, it is worth it. It is worth your time. I think I will end it here. Nadia, Dr. Ashlesh, if you have anything more to add on that, or we'll just close the session now.
दैट्स इट।
ठीक है, थैंक यू सो मच आशीष फॉर ज्वाइनिंग।
थैंक यू,
अंकुर, ओवर
थैंक
टू
यू
यू।
डॉक्टर
आई थिंक
नीलेश।
वी आर मोस्टली डन। So I wish all of you young budding urologists to just all the best and welcome to the field. Regarding IPGMER, see, few years back, 1 or 2 years back, the information was that that place is toxic. So every time these information, they change every time. So if 1 year it was toxic, that message goes across to the that hospital also. So then they do their course correction. So the updated version you must ask from the people who are doing there. Usually, I mean, if a place gets a bad name, then it continues for a long time, because a place where a person has joined and they have left it, there are very few DNB places. I will very I mean, I can say that with a lot of certainty. There are very few DNB places wherein the PG who's joined will leave, but there are a lot more MCH places that the PG leaves, because the the consultants in your DNB institutes, they're friendly, they create a friendly atmosphere. So even if you have academic classes formally or not, you end up interacting with them on a one-to-one basis, on a daily basis. So the most practical things, the things that they have understood after 30 years of being in urology, they will give you those insights on day one. So you will be nurtured through your residency program in those 3 years in that environment. So in general, what I've understood from Delhi DNB hospitals and my colleagues, the work environment and the learning is far better. So you end up coming out of that hospital after 3 years with a much more happier experience compared to some of the MCH programs that have a bad name for being toxic. So I think we'll end with that, and I wish you all the best. You have my numbers. You can feel free to get in touch with me, and based on my schedule, I will be getting back to you. And just let me know your counseling results, and yeah, I'll see you in conferences now. So Ankur, over to you.
Yeah, thank you, sir, for your session today. We can now conclude it.
Okay. Thanks a lot. Thanks.
Thank you so much, sir, for your time.
Yeah.